In this video, I will discuss many of the benefits that workers in America should be able to take advantage of. Multiple studies have shown how having the ability to take time off work for personal matters creates a better work-life balance and improves overall health. Everyone should have the ability to take a day off from work without feeling guilty or like they're going to be behind. Hostile and stressful work environments have health impacts that can cause serious issues like high blood pressure, burnout, insomnia, and depression. While there are federal and state level laws that allow workers to take weeks off of work each year, many Americans still do not qualify for it due to the amount of restrictions. Parental leave for certain employees, many Americans still do not qualify for this. Even men who have the ability to take paid paternity leave oftentimes do not. The idea that men are the providers for a family and need to immediately go back to work once their child is born is one reason why men feel unable to take time off of work. In 2004, when California enacted their Paid Family Leave Act, the number of fathers that took paternity leave did not increase by much at all. Studies have shown that some people view men who take paternity leave as less professional or less competent employees. This stigma is damaging because paternity leave has shown to improve the health of men, their children, and reduces the likelihood of divorce. Fathers who take leave are more actively involved in childcare even after the return from paternity leave. Transitioning for new fathers can be challenging, and taking paternity leave can help alleviate the stress during this period. Giving fathers the ability to focus on their family may make them less likely to engage in unhealthy eating and alcohol use, or other negative health behaviors as a response to stress. A policy-based approach is thought to be the best and most impactful way to get men to utilize paternity leave. Other nations have successfully overcome these barriers, and we are hopeful that the United States follows suit. Scandinavian countries have adopted a father's quota that provides days off that can only be used by fathers. This system has increased paternity leave participation in these countries because it allocates time for a specific purpose. These quotas provide new fathers with the days off, and it is up to them if they use it or not, and it has shown to increase the amount of fathers taking their leave days. In 2017, a male employee at JP Morgan filed a complaint because he only received 2 weeks of parental leave because he was not counted as the primary caregiver. Presumably, the mother was the primary caregiver and the father was expected to go back to work. In 2019, they settled with the $5 million agreement and adopted gender-neutral parental leave policies, which gave both parents 16 weeks of parental leave, regardless if they were the primary caregiver or not. Advocating for more paid paternity leave has made companies like JP Morgan expand their policies to allow men and women to receive the same parental benefits and time off. Despite this, there are still lots of reforms that are needed to ensure that men feel comfortable taking their paternity leave and having access to it. In 1993, the Family and Medical Leave Act was passed by Congress and was a step forward in Americans creating a better work-life balance. This act provides workers with protection when they take time off work for birth, adoption, or the foster care placement of a child. The FMLA provides workers with up to 12 weeks of unpaid leave if they meet certain standards, and while this act has provided lots of families with time off and the ability to support their children, only 56% of Americans meet the requirements. To be eligible for 12 weeks of unpaid leave, the employee must have been employed by said company for at least 12 months, provided at least 24 hours per week to the company in the past year, and are employed at a physical work site with over 50 employees. If the amount of employees at the company was dropped to only 20 as the minimum requirement, the amount of people eligible would likely increase by around 5 percentage points. Many workers, disproportionately ones without a high school diploma or GED, misunderstand the requirements and believe they are eligible when they are in fact not. By not having family leave days, these workers are unable to take time off to spend with their new child. For men that do not qualify for 12 weeks of leave, this is reinforcing the idea and policies in place that men do not need to take paternity leave and should immediately go back to work. Currently, there are no federal laws that require employers in the United States to give their employees paid sick leave. These laws vary by state. In Virginia, for example, all employees are set to accrue a minimum of 1 hour of paid sick leave for every 30 hours they worked. As of March 2023, 78% of workers in the private sector had access to paid sick leave. This leaves 28 million people in the United States without access to sick leave. In regards to men's health, there is already a stigma surrounding preventative care and prioritizing one's health. Without access to paid sick leave and considering the existing low rates of men going to annual checkups, the number of men that ignore their own health concerns will continue to rise. New policies are needed to help and empower employers to give their employees paid sick leave as a means for improved access to health care for themselves or their loved ones. State by state, these policies can vary, with only 18 states requiring employers to provide workers with paid sick leave. Mental health days are also not required by employers to give to their workers. Mental health, more specifically men's mental health, is a topic that can be uncomfortable for some people to address. States that require paid sick leave do count mental health as a valid concern that can be used for their paid sick leave days that are accrued. Mental health days can improve work ethic, limit stress, increase productivity, and help create a positive work environment. Not having the ability to take time off work for mental health reasons can cause men's mental health to worsen. Allowing workers to take mental health days can make men feel supported and give them a chance to seek professional help. Starting these conversations in the workplace is beneficial to men because they often will not discuss their mental health concerns due to the stigma. Men struggling with mental health problems are at a higher risk of developing substance abuse disorders and engaging in other health undermining activities. Implementing mental health days in the workplace can help men feel supported and like their mental health matters. More development is needed in regards to workplace policies that promote and are men's health related. Paternity leave, paid sick leave, and mental health days are all policies that have proven to benefit men's overall health. Men should be able to prioritize their own health and well being without it interfering with their work. All of these policies and continued improvements in this arena will help to alleviate stress, build stronger family bonds, and promote a healthy work life balance.